You've been told hormone therapy is dangerous, that it causes cancer, that you should just tough it out. But did you know that the FDA has just agreed to remove the black box warning for menopause hormone therapy? That warning has kept millions of women suffering for over 2 decades. The FDA is removing the black box safety warning from menopause hormone therapy HRT to reflect updated research and a more nuanced understanding of the risks. This change aims to improve access to these treatments by removing warnings about risks such as cardiovascular disease and stroke. So let's discuss what this means for you and the 3 key points you need to know before your next appointment. Plus, I'll share the biggest mistake women make when starting hormone therapy, and it's not what you think. Hi, I'm Dr. A. I'm a psychiatrist and a Menopause Society certified practitioner. In 2002, a study known as the Women's Health Initiative raised concerns. Headlines screamed that hormone therapy causes breast cancer and heart attacks. Doctors stopped prescribing it. Women suffered in silence. But here's what they didn't tell you. That study was flawed. The average woman in the study was 63 years old, not perimenopausal. Many were obese, many smoked, they were given synthetic hormones that we don't even use anymore. When researchers looked at women who started hormone therapy in their 50s, right around menopause, they found something shocking. These women actually had a lower risk of heart disease, and in the estrogen-only group, breast cancer risk went down. 23 years of unnecessary fear, 23 years of women being told to just deal with it. Now the FDA is finally catching up to the science. They are removing those terrifying black box warnings. This is huge. But here's the problem. A whole generation of doctors was never trained to prescribe hormone therapy safely. They're still worried. They still believe the old myths. So even with this FDA change, you might be turned down when you walk into your doctor's office. That's why you need to be informed. You need to know what to ask for. If you find this video helpful, subscribe to our channel so you don't miss future content that could transform your health. Let's talk about what hormone therapy actually does for your brain, because this isn't just about hot flashes. Estrogen is like fuel for your brain cells. It helps regulate serotonin, your mood chemical. It protects your memory. It reduces inflammation in your brain. When estrogen drops during perimenopause, your brain struggles. That's why anxiety spikes. That's why you can't sleep. That's why you walk into a room and forget why you're there. Studies show that women who start hormone therapy during perimenopause have better cognitive function as they age. They have lower rates of depression. They sleep better. They feel like themselves again. But timing matters. There's something called the window of opportunity. If you start hormone therapy within 10 years of your last period, ideally during perimenopause, you get the most benefits. Wait for too long and the benefits decrease. Here's what you need to know before your next doctor's appointment. First, not all hormone therapy is the same. The old study used Premarin and Provera, synthetic hormones. Today, we use bioidentical hormones that match the hormones your body produces naturally. They're safer, they're more effective. Second, the delivery method matters. Estrogen patches or gels are safer than pills for most women. They don't increase blood clot risk in the same way that oral estrogen can. Third, you need progesterone if you still have a uterus. Estrogen alone can cause the lining of the uterus to grow excessively, endometrial hyperplasia. This can raise the risk of uterine cancer. Progesterone protects you from this risk by preventing abnormal thickening of the uterine lining. Now, here's the mistake I see women make. They start hormone therapy and expect instant results. Most women notice some symptom relief within a few weeks, especially for hot flashes, night sweats, sleep disturbances, and mood changes. For some, it may take up to 3 months to feel the full effects. Your body needs time to adjust. Some women give up after 2 weeks because they don't feel different yet. Don't do that. Also, dosing matters. Some women need more, some need less. This isn't a one-size-fits-all. Work with a provider who understands this. And here's something most doctors won't tell you. Hormone therapy works best when combined with lifestyle medicine. You can't out-hormone a terrible diet, chronic stress, and zero sleep. You need protein to build muscle. You need strength training to protect your bones. You need magnesium for sleep. You need omega-3s for brain health. Hormone therapy is powerful, but it's not magic. It's one piece of the puzzle. If you want to learn exactly how to support your hormones naturally while considering hormone therapy, watch this next video where I break down the 5 supplements every woman needs to know about.